Oh man, I'm sorry. I posted short content on this channel without any context. I didn't really expect anybody to pay attention to it. Oh yeah, in addiction treatment, if all we focus on is that you're powerless over alcohol, you're powerless over drugs, you're powerless over your addiction, all we end up with is a bunch of powerless people who are dependent on something else. My bad. It won't happen again. That's totally uncool. And so let me see if I can make up for it. My name is Scott Spiers. I'm a licensed clinical addiction specialist and clinical supervisor, and I only practice in North Carolina. I've been working in the field since 2006, and I have practiced different places. I practice North Carolina, California, and Virginia, but I'm only licensed currently in North Carolina. I'm also getting closer to retirement. I've been doing this for 18 years, and I'm starting to see sunset in my career. Also, I should mention I'm a person in long term recovery, and I've been clean and sober since August 8th, 1992. I am not anti AA. I am not anti NA or any other 12 step. I used to attend. I am no longer a member of any fellowship, and maybe that's something I'll deal with at another time. But I want to be clear I am not anti AA. I do hold a bachelor's degree in psychology from American Military University, and I have a master's in addiction studies from the University of South Dakota. Uh, these are my credentials. I'm only going to break them down once because I know I need to, but I don't want to emphasize my credentials over and over again. No. Anyway, MA after my name is for master's. It's not in social work or mental health or any other type of psychology. It is strictly in addictions and addiction psychology. CCS is right after my name. That stands for Certified Clinical Supervisor. That means I train and supervise other counselors, and I only do that in the state of North Carolina. I've also been an instructor at community colleges. It's my favorite thing in the world. And even after I retire, I still plan on being involved in counselor education in one form or the other. LCAS is my main license. It stands for Licensed Clinical Addiction Specialist, which just means I'm a master's level clinician and I can legally have my own practice, which I do have my own practice here in North Carolina. The LCAS means that I can treat and diagnose all substance use disorders and all mental health disorders, but mental health disorders have to be co-occurring with a substance use disorder. So what I mean by that is you don't want to come to somebody like me if you're experiencing depression, anxiety, trauma, PTSD. For that, you want to go to a social worker or a psychologist or somebody else formally trained in it. I can work with people and treat people and diagnose if they have a co-occurring alcohol use disorder, marijuana, cannabis use disorder, etc. In my background, I've worked a whole bunch of treatment situations, including criminal justice and drug court. I've done military counseling for both the Navy and the Marine Corps, and the bulk of my career, the vast majority of it, has actually been in methadone treatment. I can only practice in North Carolina, and I'll say this again and again and again. I'm not trying to sell you anything. Unlike the recovery coaches and other facilities I find on YouTube, I'm not going to claim that I have a proprietary secret blend of recovery secrets to tell you. There's no mystical kung fu. You're never going to hear from me the truth about, well, actually, I will do the truth about addiction and recovery, but I'm not here to sell you on any of that. I know you have no reason to believe me, but we'll see. Now, at some point, I do plan on doing counselor specific material, and that will be behind some sort of paywall. I am not comfortable dealing with a lot of the subjects that I see on YouTube because it can be confusing and damaging without context. I'm nowhere near ready for the paywall thing. By the way, it would be like a couple bucks a month membership or possibly buy me a coffee. I just want to be open and upfront about that right outside the gate. Um, the reason I'm here is I have a main YouTube channel. It's called Clean and Sober Stoner, and that's my main gig. Clean and Sober Stoner is a recovery adjacent heavy music, heavy metal, stoner doom blog. But I'm starting to do material because I really want to that leans more towards mental health and addiction. And if I keep doing that, I'm going to kill the channel. So I'm moving it over here to LeeBella. I'm also the managing editor-in-chief, whatever you want to call it, for the Clean and Sober Stoner website, and also for the newly acquired Monster Riff. Man, I'm ramping up this channel because there's a lot of things I want to address that don't fit my main channel, right? We're recovery adjacent, but if I keep doing it, I'm going to kill the channel. Clinically, I'm a harm reductionist. I am fully trained and capable in 12-step facilitation, and I do actively use 12-step facilitation in my caseload. I'm also certified and use cognitive behavioral treatment. My main stuff that I use is motivational enhancement, motivational interviewing. I'm very big on stages of change theory. And so I do all the regular things. Theoretically, being a harm reductionist, I understand that a lot of people are not ready to stop using drugs. I do not advocate the use of any drugs. It's just I have a point of view that comes from years of studying research that shows me that taking a pragmatic approach, addressing the most harmful behaviors, the most harmful things first, it just fits my personality and my temperament. As far as 12-step treatment, I keep mentioning it, but I don't believe in 12-step treatment because I don't have to believe it. Clinically, it is a valid approach, and I've seen it work time after time after time after time. That being said, my warm fuzzy, my place is to work with people who are treatment resistant or resistant to traditional approaches. That doesn't mean the other traditional approaches don't work. It's just that they don't work for everyone. And to be totally honest, I don't see a lot of the other stuff available, especially harm reduction. I don't see that available, especially on YouTube. And it's really hard. You go online, how do you find it? So there's almost all the material on YouTube is 12-step. So will I point out reasons why people don't like 12-step? Absolutely. This channel is not for people that are in 12-step recovery. Honestly, this channel isn't really for people who are in recovery because don't listen to me. You're in recovery. You have a therapist, you're fine. But I do want to make sure material is out there for other people for whom traditional, ways of looking at things isn't working. Man, I have spent a lot of time watching mental health YouTube and addiction and recovery YouTube, and I got to be really honest with you, a lot of that stuff scares the shit out of me. I have seen some truly horrific things on YouTube from so-called recovery coaches. And at the same time, I do see legitimate, really good content, but it's coming from the mental health perspective, not so much from the straight addictions perspective. Again, all these things, not the recovery coaches. Recovery coaches are not valid. I'll die on that hill. But as far as the traditional stuff, it's fine. It's fine. They're just not the end-all, be-all. So I think that's what I bring to the table here is a different perspective, a different point of view. I don't intend to be confrontational. I don't intend to be controversial. And I don't mean to offend anyone. That being said, I know that I'm going to. I've already seen the comments. I've already ruffled feathers. Not once in my little short thing did I mention AA. I was actually, at the time, I was thinking about how we approach mental health in our current culture. We've turned everything into a disease. I mean, if you're insecure on your first day of work or you just got a promotion, now you're going to have imposter syndrome. Everybody is codependent. When you break up with someone, they were gaslighting you, or just because now they're narcissistic. We spent a lot of time in our culture labeling things, and I think that's too bad. So I am gonna poke the bear on a lot of those concepts. So I know I'm gonna offend people, and I know I'm gonna confuse people, and that's, we're in the social media environment, man. And by the way, there is zero reason for any of you to believe anything I'm saying. There is zero reason for any of you to believe in anything that I'm presenting. The best I can hope for is, hey, give me a shot. I tend to be very irreverent. I do have a certain amount of sarcasm. I'm obviously not like a formal dude. By the way, if you're my patient, this is what you see. I still have the clean and sober stoner thing. I think I have one album out. It's Blackmore's Rainbow, but I usually have albums out, and it's very informal. It's a lot of fun, and I love working with my clients. Now, initially, I'm going to be sticking to content on here based around ethics, patients' rights, and probably a basic overview of what I have found to be fundamental recovery basics. As a clinical soup, I get to train and teach people, and there's two ways that I teach. I teach to pass the counseling exam, which it's not proprietary, it's not secret, but I do have a method of working on being able to pass the IC and RC and the NADAC counseling exams. I love doing it. It's just fun. So I'm going to be presenting material, probably related to that, but that's it. As far as counseling theory, how to approach stuff, and things that I know are controversial, that we'll cover later. But for right now, I just want to keep it kind of simple. I'm not going to do any of those clickbaity thumbnails. If you need to watch this video because I have a Mr. Beast level clickbait, this isn't the channel for you. It's going to be probably a picture of me going, or something like that, and then a little title. The thumbnails will be boring. The content, I'm going to do everything to make sure that it's not boring. So, look, that's my intro. That's it. Going forward, I'm going to try to do a much better job of putting things in content and not putting things out there just to get a reaction. It's cheap. I know it's effective. It'll get me views, but yeah, I think we've all been traumatized by the constant gotcha reaction type stuff. So I'm going to try not to do that. Besides, the real truths behind addiction, recovery, and counseling are shocking enough. Yes, I can tell you right now. I just watched a YouTube video on the 5 recovery myths, and 3 of what they said were myths, and they gave the counter narrative. What they presented were myths also. No evidence to support the assertion. Anyway, look, it's a controversial topic, so I can't avoid it. It's like Tuckman's stages of group: form, storm, norm, perform. In this video, we're just forming. This is our Oprah Kumbaya moment. Eventually, I'll put something that'll make everybody go nuts. That'll be the storm stage, which is more like Jerry Springer. And if I do things the right way, and I pay attention, and I'm mindful, we'll get into more of a norm and perform thing. If you're a counselor, that's something you want to know for the exam. If you're just somebody looking, it might not have made sense to you, but that's my little Easter egg of counseling theory. Again, no clickbait thumbnails. I'm not trying to reach that audience. I just don't want those. So anyway, that's it. That's my kind of short introduction. Thank you for watching. I hope you stay tuned. If you are struggling with an addiction or mental health, please get professional help. I think we all know that the national addiction, you can just dial 988 if you're feeling suicidal or suicidal ideation at any time. And thanks for giving me a watch. You watched all the way to the end? Really? This is an intro video. What are you doing watching the man? What are you doing, man? There's other things. Go do good things. Go. See you later.